hand over here, and that is actually showing into the costodiaphragmatic recess. That is costodiaphragmatic recess, which is like more inferior, most dependent one out of the two recesses. And just look at this hand over here, and that is actually projecting into the costomediastinal recess. So from here, from this diagram on the screen here guys, it is like crystal clear, costodiaphragmatic recess is more inferior, whereas costomediastinal recess will be actually more anterior. That is the reason why whenever there will be pleural effusion, accumulation of abnormal amount of the fluid, whenever there will be pleural effusion, like more amount of the fluid will be accumulated into the costodiaphragmatic recess, and that is the reason why what are we doing here? We are inserting the needle here along that mid axillary line, and we are trying to take that fluid out, and that is known as the pleural tapping. So pleural tapping is done along the mid axillary line because of this reason, because of the presence of costodiaphragmatic recess over there, and the collection of fluid will be into that one only. It makes sense right now. So therefore you got to remember here, out of these two recesses, that is costomediastinal recess and costodiaphragmatic recess, which is like more inferior, that is costodiaphragmatic recess is more inferior. Or we can say, or we can use one more word, it is most dependent recess. Out of the two recesses, the most dependent one will be costodiaphragmatic recess. Therefore, that is used for pleural tapping. That's the reason why it is used for pleural tapping. And we have discussed about that in detail when we studied about the intercostal space, like where exactly we are doing the pleural tapping along mid-axillary line, and that to 7th or 8th or 9th intercostal space we are doing there. And then we have also discussed while you are inserting the needle, which muscles you are going to cross one by one. We have done that in detail in the intercostal space topic. So try to correlate these two topics here, and the things will become much more easier for you people guys. Perfectly done. So that is all about the information regarding the pleura, the visceral pleura and the parietal pleura, and the space between the pleural cavity, and most importantly the recess, costodiaphragmatic recess as well as the costomediastinal recess, and what will be the applied aspect of this one. Why do you have to study this, and what is the correlation with the pleural tapping? Perfectly done guys. And now after completing this, let me tell you about one important fascia which is present right at the thoracic inlet over here. So near this thoracic inlet, you will be actually having fascia, and that fascia is referred to as Simpson's fascia. And that Simpson's fascia is just covering that apex of the lung. And what are the important points to remember regarding that? Let me tell you about that in detail over here guys. So now let us discuss about the Simpson's fascia guys, that is the suprapleural membrane. So first of all, write down the heading there. It is also known as suprapleural membrane.